This is a 24/7nursetutors.com lecture. 24/7 Nurse Tutors, providing unlimited tutoring.
Welcome and thank you for joining us. Maternal Newborn, Part 3.
Now let's discuss the types of regional blocks. The pudendal block provides quick pain relief to the perineum, the vulva, and vagina. The peridural block is an epidural or caudal block. The intradural is a subarachnoid or spinal block. The client must remain flat for 6 to 8 hours after delivery once receiving a block. The fundus descends 1 centimeter a day for 9 to 10 days and returns to the symphysis pubis. If the fundus is not midline, then you catheterize the client. If the fundus is not firm, then you need to have a fundal massage. Preeclampsia or eclampsia. The HELP syndrome. Hemolysis, elevated liver enzymes, low platelets. This is a life-threatening complication usually considered to be a variant of preeclampsia. It is an extremely severe form of gestational hypertension. Symptoms include swelling, headache, nausea, vomiting, indigestion with pain after eating, abdominal or chest tenderness, and upper right upper side pain, which denotes liver distension. Also shoulder pain or pain when breathing deeply, bleeding, and changes in vision. What is the drug of choice for preeclampsia? That's right, magnesium sulfate. So what do we do when a mom comes into the hospital who has been diagnosed with preeclampsia? Well, we control the stimulation in the room. Monitor BP every 15 to 30 minutes and DTRs in urine for protein every 1 hour. We also monitor magnesium levels and signs of toxicity. Urinary output less than 30 mL per hour, HR less than 12, DTRs absent, deceleration of FHR, and bradycardia. We certainly hope not, but mom can have a seizure. What do we do if the patient has a seizure? We stay with the client and get the facts: focus, activity, color, time, and somnolence. Administer oxygen and have suction available. Give magnesium sulfate as prescribed. Nursing interventions. For eclampsia, magnesium sulfate to prevent and control the seizures. When should magnesium sulfate be held? Right, with a low DTR or depressed RR. Seizures can occur postpartum. The rubella vaccine. This is given subcutaneously to non-immune clients before discharge from the hospital. Can the client breastfeed? Yes. An immunocompromised client? No. After the vaccine, how many months must the client avoid pregnancy? That's right, 3 months. Let's discuss gestational diabetes. A 1-hour glucose screen is given between 24 and 26 weeks. For type 2 diabetes mellitus, regular insulin is used during labor because it is shorter acting and has a better glycemic control. Now let's discuss preterm labor. The signs of preterm labor is more than 5 contractions in an hour, with a low, dull backache. There is pelvic pressure which increases or changes in vaginal discharge. Tocolytics, magnesium sulfate, terbutaline, nifedipine, indomethacin. A preterm birth is less than 35 weeks gestation. Betamethasone or celestone is used to enhance surfactant production. For lung maturity, you give 2 doses of 12 milligrams given IM, 24 hours apart. Let's discuss ectopic pregnancy. Early signs of pregnancy are absent, but a positive pregnancy test is shown. There's a rupture, a sharp unilateral pelvic pain, and vaginal bleeding. Referred shoulder pain, syncope, can lead to shock. Interventions, surgery, IV fluid, and blood administration. Some women have an incompetent cervix. This is usually presented during the 2nd trimester. An incompetent cervix is defined as passive and painless dilation of the cervix. Management is bed rest, hydration, tossulosis, cervical cerclage may be performed. The stitch is generally removed around the 37th week of gestation. Post-cerclage, monitor patient for overnight to ensure that she does not go into premature labor. Patient education. Strict bed rest, no physical activity, no coitus for up to 2 weeks. Abruptio placentae and placenta previa. Abdominal or vaginal manipulation contraindicated. No Leopold's maneuvers. No vaginal examinations. No internal monitor. No enemas or suppositories. Which is painful and has a board-like abdomen? Abruptio placentae. Bright red bleeding? Placenta previa. With placenta previa, the placenta partially or completely covers the cervical opening. With abruptio placenta, or sometimes referred to as placental abruption, there is external bleeding. The placenta is separated from the uterus. There is also internal bleeding. Dystocia. A difficult birth resulting from problems of the 5 P's: powers, passage, passenger, psyche, and or position. That is, a lack of progress in cervical dilation, delay in fetal descent, or change in uterine contraction characteristics suggest dystocia. For example, with shoulder dystocia, the baby's neck is stretched and damaged during birth. Disseminated intravascular coagulation. This can be caused by fetal demise, infection or sepsis, pregnancy-induced hypertension, preeclampsia, or abruptio placentae. Remember, you are more than a conqueror and you will be successful. Join me as we review core content in the next unit.